In nutshell, homeopathic doctors will act as a two ways. First is a primary doctor. Primary doctor is one where the patient will come and say that I am suffering from some swelling ulcer. So we have to diagnose. That time we have to refer to a specialist like Pi Healthcare and Dr. Venugopal like doctors and to know, diagnose, staging, grading, etc. This will definitely help. According to a pioneer homeopathic oncologist, Dr. Sujit Chatterjee, the homeopathic doctor who is in association with the oncologist will be the best homeopath in oncology. So I request you, all of you, to take care of their services. They are coming forward to help us, and we have to take care of their services for the best, diagnosis and treatment of, cancer patient. And second is secondary, as a secondary doctor. Secondary doctor means where patient has taken many medicines like chemotherapy, radiotherapy, etc. And they will come for us for the further treatment. In these cases, definitely homeopathy has a super role, and we have seen all the patients are benefited with homeopathy, and their survival rate is also increasing because cancer is nothing but every patient feel that it is a panic, it is a fear, it is a death, but it's not so. It's not so. We have seen in many cases, patients are surviving with the help of allopathy, followed by homeopathy or homeopathy itself. We have seen these cases now. So what is the approach in homeopathy? This is very, very important. So what is the normal cell versus cancer cell? This is we have to understand this. Cancer cell is, normal cell follows certain pattern. So it will grow and die. Again, another cell will come. But cancer cell will not follow this pattern of normal cycle. It will grow, multiply, and it will go and destroy other cells as well. So this is a cancer cell. So we have to follow a method. If the patient has come to you for cancer treatment, we should follow one treatment called, usually we give genetic medicine, genetic constitutional similar or holistic. But in cancer cases, we have to follow phenotype of prescriptions. Initially, in the cancer, what is meant by phenotype prescriptions? We have to understand what is the cancer, where the location, sensation, modalities, concomitants. Concomitants could be PQRS symptoms as well. So don't worry about constitution, because we have to follow the local by leaving the global. Global is mind. We should follow the local. That's why you are seeing the cases arsenical, hydroxis, whatever it may be, they are helping because they have not taken entire constitution. So we have to follow the gully, not the Delhi. Delhi is the mind. If you understand the mind, everything, that will going to be hazard because the case is only local. So it is called phenotype of prescriptions. When any patient comes to you for first time and he is diagnosed as cancer, you have to find out phenotype of prescriptions based upon Bonning-Hassan's totality of symptoms, location, sensation, modalities, concomitants. Concomitants could be PQRS symptoms. For example, a case of stomach cancer has come to you, and just observe. You should have a good observation power. What is meant by good observation? Cancer patient, case of stomach cancer has come. So you observe that there are deep cracks in the corners of the mouth. So this is nothing but gone wrong. So we should have, the local symptoms, PQRS symptoms. For example, patient has stomach cancer and he's vomiting everything. For example, liquids he is vomiting and solids he is retaining. So you have to give this one. And the patient is vomiting both liquids and solids. You have to give arsenic. Such type of, for example, hydroxis he was telling. You see that lot of mucus, yellowish mucus is coming up. So you have to give that type of. So don't worry about genotypic, genetic medicines, genetic constitutional similar in that case. You have to follow the phenotype of prescription, and you should be well versed with Allen's keynotes and Boring. This is what I would like to say. You want to be the best homeopathic doctor, especially in cancer. Once the case has been treated, for example, Dr. Venugopal sir was telling about breast tumors. So when we send you and the tumor was removed and there is no tumor, patient is doing well, then you have to consider genotype of prescriptions. So that to prevent the recurrence. So in all the cases, blockbuster remedy is carcinosin. You have to give the carcinosin, it is a blockbuster remedy in many of the cases. Many nosodes, sarcodes have to be given in all the cancer cases because cancer is nothing like an onion. So you remove one layer, another layer will be there. So remove another layer will be there. So there is a lot of onion type of things are there. And we have one of my PhD student, PhD scholar, Dr. Ramalakshmi is working with cancers and different role of different therapies in homeopathy, like many methods we have compared. And she is working since 4 years, and homeopathy is doing very well in all the cases. Even some of the conflicts like GNM has to be taken into consideration. In a way, when a pure cancer case comes, you have to follow the phenotype of prescriptions. What is the location? What is the sensation? What are the modalities? And what are the concomitants? Concomitants could be a PQR symptom. If you find this, definitely cancer case will be benefited. And I'm very thankful to all of you. And my request to Dr. Venugopal sir, you just include one of the homeopathic practitioner in your hospital, so that your Pi Cancer Hospital will become pioneer cancer.
Actually, I thought of giving gist of what I heard from you. So I was just going through the cases. Definitely, I was really surprised and actually good to know that our alternate forms of medicine are working so excellent, because I have seen CS stomach, ALL, and rest. The real success, what I feel you rightly mentioned, definitely incorporate alternate systems of medicine along with the standard of medicine, what we use in terms of chemo radiation. Because cancer has to be treated on an integrated fashion. That's definitely, there is no doubt in that. Because when the patient gets exposed to chemo radiation, they have a lot of side effects. And I'm actually confident enough to tell that most of them symptoms cannot be relieved by the medicines existing in the systems. So there comes the importance of integrated practice of medicine in oncology, especially. I mean, if I may quote, there is one for pain relief. Some people even use ganja-related products, and the efficacy is huge and excellent. So definitely, with as you were telling in the end, with the integration of all the available, definitely the patient is going to be benefited. And you rightly mentioned that in the initial stage, of course, I feel the importance of the existing conventional methodology in terms of CECT, thorax, abdomen, pelvis, PET-CT, subjecting the patient for biopsy, and then going ahead with it. I feel when it comes to palliation, I mean, in our opinion, what we have a different system of medicine study right from MBBS, MD, So, but even in Devita, what is our textbook for oncology? It's like Bible for oncology practice. So there we have a separate chapter called alternative medicines in terms of Unani, Ayurveda, homeopathy, and I don't remember exactly. So the concept of integration of these medicines for the standard treatment were well mentioned and well noted across the group, I think. Thank you.
Thank you, sir.
Thank you very much.